Dr. Ennis, you mentioned that, as a person has a back pain, which may have come via an injury, and of course it may have come through long time making certain movements or doing things which, kind of made the spine or some nerves deteriorating. Either way, you mentioned, I don't know whether it was preventive kind of, or at least it was like home remedies, home type of things a person can do. Can you go into a little more detail and tell us some of the stuff and tell us whether that will help preventing things, or whether once you have it, things you can do to make things better?
Oh, sure. I'd be delighted to do so. The biggest mistake that people make is that they allow themselves to become overweight, and they also allow themselves to become deconditioned. And so to prevent back strains, particularly if you're in a position of manual labor, the first thing you should do when you're getting ready to do manual labor is to make sure that you stretch like an athlete stretches before he works out. And so stretching those muscles before you work out, before you have to do that manual labor, is really important. If you want to prepare yourself for that manual labor by having a lifestyle that supports good nutrition, that's a real plus. If you want to support that work with a lifestyle that adopts a normal weight, that's also a plus. Making sure that you don't smoke, and making sure that you eat well-balanced meals, nutritious meals, is also a plus. So there's several things, if a person has back problems, there's several things that they can do themselves to make things better.
Is there any way that you can, maybe not here, but that, let's just say a person can, who is in your neighborhood, step by and get some type of instruction or some type of, call it brochures or whatever it is, on what type of exercise and stretches to do? You see, my wife does like ballroom dancing and Argentina tango dancing, and quite often, she comes to me and she says, I just learned how to move this muscle today. And I go, what muscle? I didn't even know there was a muscle. I mean, the point is to do the right stretching, I'm sure, has a big difference. And, I have done sports in the past, from judo, I ski. So I do know that it is. I don't know all the stretching, but I do know that when a particular coach shows me a particular stretching or a particular, make that muscle strong, next thing you know is I ski better. I didn't even know that muscle was important for what I do in skiing. Do you have any such advice for people, not necessarily here, but does that exist in your practice?
We don't do that very often, but people that come in and ask for that in preparation to go to Colorado or something of that nature, but we do that on patients that have back strains when we return them to work. We give them an exercise program so that they can keep their back conditioned so that they have a lower chance of having another back strain.
Well, that's the one I'm talking. I'm not talking about you having exercises to make my skiing better. I'm talking about, to have exercises which actually makes our back or our neck or our wrist stronger so that we don't injure it as fast in the first place.
Well, certainly, most definitely, yes. We certainly do.
Good. All right. So a person could come to you and get that preventive thing just right off the bat so that he goes about his job at wherever with a little bit more peace of mind because he learns how to strengthen the right muscles.
Actually, we've done some things along that line with some of our industrial accounts. We have a therapist that can go out to a facility and teach a group of people to exercise and condition. And so it really is an important thing.
Right. Well, I assume so. I mean, after all, I think it was you doctors who came up with an ounce of prevention is worth a pound of cure, right?
Absolutely.
We just kind of like use it for a lot of things, but it is you guys who came up with it. Thank you very much. Very informative. I appreciate your candidness, Dr. Ennis.
Thank you.